If you've been diagnosed with plantar fasciitis or you're worried you might have it, you may be wondering whether you need an MRI, an X-ray, or an ultrasound to find out what's wrong. The answer surprises a lot of people. In this video, I'll explain when imaging is actually helpful, when it usually isn't necessary, and why MRI findings don't always explain how much pain you're feeling. By the end of this video, you'll know when imaging is appropriate, what common findings like heel spurs actually mean, and why we always treat the patient and not the MRI. One of the most common questions I get in clinic is, do I actually need an MRI for plantar fasciitis? The short answer is usually no. In most cases, plantar fasciitis is a clinical diagnosis, meaning it's diagnosed based off your history, your symptoms, and a physical examination, not an MRI or an X-ray. If you have pain on the inside of the bottom of your heel, tenderness where the plantar fascia attaches to the heel bone, pain with your first few steps in the morning or after sitting for a while, and your symptoms fit the typical pattern we've discussed throughout this series, your healthcare provider can often diagnose plantar fasciitis without any imaging at all. So if imaging usually isn't necessary, why do people get X-rays or MRIs? The biggest reason is to rule out other conditions when your symptoms don't fit the typical presentation or when you're not improving as expected. For example, imaging may be considered if your healthcare provider is concerned about a stress fracture, a tendon injury, inflammatory arthritis, a nerve condition, or another cause of heel pain. Imaging may also be appropriate if you've been following a well-designed rehabilitation program for several months without making meaningful progress. At that point, we want to make sure we're treating the correct diagnosis. Let's talk about X-rays first. One of the most common findings on an X-ray is something called a heel spur. Many people are surprised when they're told they have one and immediately assume that's what's causing their pain. In reality, that's not usually the case. Heel spurs are extremely common, especially as we get older, and many people with heel spurs have no heel pain at all. On the other hand, many people with plantar fasciitis don't have a heel spur at all. Think of a heel spur like wrinkles on your skin or gray hair. It's often a sign that your body has adapted over time, but it doesn't necessarily mean it's the source of your symptoms. The same concept applies to MRI findings. An MRI may show thickening of the plantar fascia, increased signal within the tissue, or swelling around the fascia. These findings can support the diagnosis of plantar fasciitis, but it's important to remember that imaging findings don't always match how someone feels. Some people have noticeable abnormalities on MRI and little or no pain. Others have significant heel pain with only mild imaging changes. It's also important to know that complete tears of the plantar fascia are very uncommon, even if your heel pain is very painful. It doesn't automatically mean you've torn your plantar fascia. This is why you'll often hear healthcare providers say, treat the patient and not the MRI. Many people become worried after reading their imaging report because the wording sounds alarming. It's important to remember that radiology reports are written for healthcare professionals. They often describe every age-related or incidental finding, even if those findings have nothing to do with your symptoms. The most important question isn't, what did my MRI show? The most important question is, do the imaging findings actually match my symptoms and my physical examination? For most people with plantar fasciitis, imaging doesn't change the treatment plan. Whether or not an MRI shows thickening of the plantar fascia, the foundation of treatment remains the same. Managing load, improving mobility where appropriate, progressively strengthening the foot and the lower extremity, and gradually returning to the activities that you enjoy. When it comes to plantar fasciitis, your symptoms, your physical examination, and how you respond to treatment are usually much more important than what an MRI or an X-ray happens to show. So, do you need an MRI? For most people, the answer is no. A careful history and a physical examination are usually all that's needed to diagnose plantar fasciitis and begin an effective treatment program. Imaging is best reserved for situations where the diagnosis is unclear, you're not progressing as expected, or your healthcare provider is concerned about another condition. In the next video, we'll begin the rehabilitation process by walking through beginner exercises that will help reduce pain and start rebuilding the strength and tolerance of your plantar fascia.